Hello, everyone. I'm Bharat Rajpalli, Digital Health Program Manager at Bayer G4A. On behalf of the team, we would like to welcome you all to our second Pitch Club. We have created this event to give five digital health startups an opportunity to pitch their solution to relevant industry professionals, gain valuable insights from our jury members, and get the exposure they need to raise their company's profile. Just as an FYI, we do have an audience Q&A as well at the end. So please feel free to type in your questions and we will get to those as a first come, first serve basis. So without any further ado, I'd like to introduce our jury members. So first, we have an all-female panel this year with Sophie Park, who is the managing director at Bayer G4A. Hello, Sophie.
Hi,
Next,
Bharat.
we have Christy Ebong, Head of Partnerships and Market Development at Define Ventures. I believe there's some issue with Christy. I think she should be added on here soon. Okay, moving on. I'd like to introduce our first startup, the Lingos. Can we have Matt on screen,
Hello.
please? Hey, Matt, how are you doing?
Pretty great.
So we'll start with your company first. Please share your screen, and you'll have 3 minutes to pitch. I will hand it over to you.
Sure, I'm ready. Should we start? Okay, then. Hello, everyone. My name is Matt, and I would like to present to you a project I have been working on for the last few months. The Lingos is an app that provides speech therapy for kids using gamification and machine learning. Main characters are ghosts that teaches and plays with kids to help them speak better. There are more kids than ever that need speech therapy, and there are not enough excellent therapies to provide it. It is estimated that speech defects will soon be considered a disease of civilization. So let's help children and their parents at the same time. The solution is an app that we call Medical Game. It provides speech therapy for kids in the fun form of a game. It uses speech recognition to identify words that kids are saying wrong or not at all. It is being designed to be attractive for kids, convenient for parents, and professionally prepared by, and especially for speech therapists. So let me show you what it's really about. The Lingos will be a game that helps children with speech problems to improve their pronunciation, articulation, and fluency. It will also help them to learn new words and concepts. On the other hand, it is a medical tool because thanks to artificial intelligence algorithms that recognize sound, the application itself diagnoses a speech therapy defect in kids, proposes an appropriate therapy, and checks its effect. The parents also can always check the child's progress, even we don't live in the application, consult them with live speech therapists. So you could wonder, will it work? The Lingos is being developed by a team of professionals from the fields of speech disorders, also with game programmers, game designers, and machine learning specialists. So we are sure it will work. We believe this is the best time for our app. Voice recognition algorithms are the future. Apps are already being prescribed by doctors, and speech therapy is becoming more popular. The market is already sizable, and forecasts show it will get even bigger. But that's not all. We know that to help kids, you want to become something that kids will love. So in the meantime, while we are working on the design and mechanics of the game, we have also been working on an animated series. So kids can fall in love with the characters who, by the way, have their own personalities and their own stories. We believe that we can successfully combine gaming with medicine, all for the sake of children. That was the Lingos. Thank you all for listening, and please feel free to ask your questions.
Great. Thank you so much, Matt. Next, we can go for a feedback and questions round with our jury members. Can we have Sophie and Christy? Hi, Christy. Hi, Sophie. So you guys have 10 minutes to ask your questions and any feedback to Matt on the Lingos. I'll let you guys do it. Sophie?
Sure. I have a couple of questions. I know we only have 10 minutes, but I'm going to try to get through and give Christy some time to ask too.
Yeah, go
Hey,
ahead.
Christy. And also, hi, Matt. Very, very nice to meet you guys. Or actually, I already know Christy, but very nice to meet you, Matt.
Nice to meet you too.
Really, really cool product. I have a comment and also a question. I want to just comment that, in digital health, I know that at least a lot of us work with products for adults, but I think it's really important to also have solutions available for children. And so whenever I do see, health technology for kids, I find it really interesting. You mentioned that it is a diagnostics platform, correct?
Yes.
And I'd
So-
be curious. Yeah, go ahead.
Yeah, so we actually have planned to use a machine learning to actually detect the defects that kids have in their like speech patterns. And we actually I can give you like some technical overview how it works. It's basically it compares to like a lot of other examples that we have. So we work with speech therapists to gather all of these patterns of kids that have problems, and then we compare all of them to new cases, so we can detect all of these problems and select the proper therapy for the kids, proper games, for example, for them to play. So it always will be like perfectly, at least should be perfectly balanced for the kid.
Are you currently in the EU right now? Is that where you guys are in the market?
Yeah, we are actually in Poland.
Okay, and you already have users and customers as well.
We have some users because we work with speech therapists, but not yet much. We are not yet like open to public. We are only like having private tests with some speech therapists.
Okay, I know this is my final question, but I would love to understand your business model
Sure.
a little bit more clearly. So could you kind of take me through that?
Okay, so the business model is very simple. I can also maybe show you quickly my presentation still, because I have some slides especially for this. So first of all is how we would like to acquire the users. We would like to go to schools, to preschools, to some maybe influencers, and we work with speech therapists because we want the speech therapists to be part of our platform, and it's very important for us because we don't believe that without like proper speech therapies we can execute all of these games, make them work perfectly for the kids and be tested, especially like how they should work. This is one of the most important things, and we think to actually like earn the money on the platform for it's not yet like finalized. It's not yet for us to be. We are not yet sure how to make it exactly. But our plan for now is to have part of the platform open to everyone, so it will grow up, and kids like from the beginning, kids will be able to learn at least like most of the important things, and then for more advanced things, we will be able to have maybe some paid plan for them. Of course, it will be based on the parents. Parents will decide everything and how much they would like to pay and how much they want the time for the kids to spend on the app and other things like that.
Thank you. Very helpful.
Great, Matt, thank you so much. This is really exciting and interesting. I'm a huge fan of the therapies and think that really believe in what they can do. Talk to me a little bit more about your payment model in terms of in the different markets and where do you view you want to start? Do you want to go direct to consumer? Are you looking at getting payers involved, employers, schools? Mm-hmm.
Yeah, so at the beginning, we want to start with the speech therapist. So this will be platform for the speech therapist to provide it to the kids they work with. So like application will be also support like multiple of the kids at the same time, or the therapist could use multiple phones to have the same kids to use it for at the same time. Like because at the beginning we have noticed that especially like in schools there are like speech therapy, especially like the primary schools, there is like speech therapy for kids, but it's not often as great as we would like to for it to be. So this is why we want to start with this one problem that we have noticed. And of course, for the different market, it will look maybe a little differently, but this is our plan to actually have it like here, like this.
That's great. And then how do you view in markets like the US where you have well child visits that are really primary care team driven, and that's really where the majority of the evaluation on a child's development happens day to day, just because the teacher to child ratios in the schools are not always optimal. How do you
Yeah.
view getting in through that primary care wedge? Because the clinicians are a very different wedge, right, than the educators.
Yeah, so our app and games, but basically that in the app is are just only the beginning, and we plan to have like animated series. I have mentioned it in the pitch that we would like to have like maybe publish it on the Netflix, so kids will be able to watch it and then learn from it a little. We also get familiar with all of the characters, and then parents. Because they would see it's actually being like popular with the kids. Like there is right now a lot of animated series that kids just love to watch and would like to be like one of them. And with that, parents can install the application on their phone, give the phone to the kid, and the application will be prepared for the kids, even like the small kids that can't yet write, if they will be able still to use the application, and this is how we would like to fix the problem that you mentioned.
Great. Yeah, one consideration for you all to think about is as you approach different markets, if you have to go to educators in one market and clinicians in another, that there are considerations in terms of how you build out your sales team, right, and your BD teams, so that you can get efficiencies of scale. So I'd be really curious to see that early traction. I love the ideas around partnerships and just the gamification and kids getting excited. I know mine are coming out of a Paw Patrol phase and into the next one, so I'm familiar with that dynamic.
Great.
And let's see, how much time do we have, Brett?
I think we have a couple more minutes, but I would love to ask, Matt, because there's over 120 people that are watching, and, it's everyone from startups to investors, and also, entrepreneurs just like yourself. Maybe, you have myself and also Christy on here in Bharat too, but it would be great to hear from your side, what's your next milestone? What do you guys really need to scale and to grow?
Yeah, so we actually work right now with speech therapists to gather all of this data for the machine learning model. And our next step is to show everyone that it is possible to detect them like autonomously, and to have like the application, like the MVP version of the application, to show with some games that kids are able to learn from it and would like to actually use the game and just learn, basically just learn. And this is like our next step that we want to have. We want to gather some data so we can prepare the game, and we can, and with the game, with a machine learning algorithm, we would like to have the kids to actually be able to already progress in their life.
Matt, talk to me a little bit more about from the content perspective, what the costs and the COGS, if you will, are going into the content. Is it more of a one-time lift, and then they elevate kind of through the levels based on developmental stage, or is there a broader content element to growing the business that needs to be considered?
Yeah, so with the content on the application, like for example, in Poland, with the speech therapists that we work on, they have around 750 games that they provide to the kids. And we'd like to have probably around the same amount of the games, because they teach almost every part of the human speech that that people actually use. And with all of that, we would like to have probably around the same amount of games. Of course, it will not be able to, for us at the beginning, to have this many games, but eventually we'll be able to provide all of them. So all of the games will be separate, at least in some way, but they will have some parts that are that joins them together. Like for example, these characters that just have their own stories, have their own personalities. Because we think that kids will learn better when they could have like one of these characters. They find themselves very similar to one of these characters, and we would like for them to be able to choose maybe the character that is best suits them, and go to all of these games together with the character and with the ghost actually, because the characters will be ghosts, and like progress like through the world together. This is our idea how it would look like.
Great. I think we have time for one last question or any kind of feedback to Matt.
Yeah, Matt, this is super exciting. I can just see beyond even starting with speech therapy for pediatric market, how you could expand out into adult market, stroke rehab. I mean, the possibilities are really endless. Talk to me just briefly about how you view the competitive wedge. I know you mentioned IP in your deck, but in terms of going to market in so many different places, what are you navigating against in that competitive space, and how are you going to edge out the competition?
Yeah, so this is why we actually would like to work with the speech therapists at the beginning, because it's just easier to go to the kids, and especially it will give something to the speech therapists. Like our application will give them ability to work maybe better. Would have all the analysis on the kids, so they will be able to check the progress and how they process. So it will be the easiest way for us. But especially as we don't have like direct competitors right now, we don't have like an application that is able on any of the stores that gives you the ability for the kids actually to learn how to speak properly. There are some applications for adults. For example, there is one of the names is Elsa, that shows you that it is possible to have this kind of application, but it doesn't work for kids. It only works for adults that would like to practice the English, for example. So our idea is, first of all, to go through the speech therapies, go through maybe schools, and then with the animated series and with the application on the maybe Google Play Store and on the iPhones too, we will be able to get the more broad audience.
Great. Thank you so much, Matt. And thanks, Christy and Sophie. Now we'll move on to the next startup. So next we have Dana Health. So I'd like to welcome Sven and Veronica from Dana Health.
Hello everyone.
Hello. Hey, Sven. Hey, Veronica.
Hi.
Please share your screen, and you have 3 minutes to introduce your company. I'll let you guys do it.
This is Maria. Maria can be you, your wife, your sister, daughter, or friend. As a woman, Maria should be happy to become a mother. But is she really? And does it matter? Studies show that there's a 90% probability for women to experience some kind of mood disorder during motherhood, and up to 25% probability to suffer a severe mental health pathology. But we will never know who is affected. 75% go underdiagnosed, and we won't be able to help. Mood disorders and mental health pathologies during motherhood have a direct impact on the mother's health and her capacity to take care of the child, with potential long-term negative effects for her and for her baby. That's why we developed Dana. Dana is a well-being app informing and empowering women during motherhood with specific features designed to answer the pains and needs. Dana is also a software as a medical device and a digital therapeutics tool for the healthcare system, helping healthcare professionals for the early detection, diagnosis, and monitoring of mental health pathologies during motherhood. We are focusing on the massive mental, physical, and social transformation of a woman who is becoming a mother, a period called matrescence. Our IP is the Maternal Vitality Index, measuring the mental and emotional experience of the woman. We launched our first MVP in March, created 30 psychoeducational programs, and tested them with users with a 70% efficacy. Second MVP released in October to validate the product market fit. Next year, we will build the medical device interface and launch clinical studies. Objective, achieve the medical device standards and a digital therapeutics certification. We are starting with a free wellbeing app to capture user data that will later be converted into a premium solution and distributed through health agents and employers with a revenue share model. We will evolve them to a digital therapeutic solution for the healthcare system. We are competing in two markets: mental health medical devices, non-focusing on motherhood today, and well-being apps, non-reaching medical device standards. Dana starts in Spain, impacting 2 million women to prove the scalable business opportunity. Next step, expand to Germany, UK, and US. Veronica and myself launched digital venture in the past and had the opportunity to lead international companies in different countries. Our motivation to launch Dana lies in our own personal experience. Veronica tried several years to become a mother without success, and I was not able to support my wife's mental state during motherhood. We are blessed to be backed by a great team and international advisors from a variety of specialization and verticals. We started with 75,000 euro in the first round and opened a second round to accelerate the product market fit phase. We're looking for partnerships to cut the underdiagnosis rate in Europe by half in 4 years and offer a monitoring tool for healthcare professionals. The market potential is huge, and with your help, we can improve the health of millions of women, of their children, and their families. There we go.
Great. Thanks, Sven. Thanks, Veronica. We can have the moderators on the screen now. Great.
Great. Good morning from San Francisco. Sven, Veronica, thank you so much for building in this space. As a mother of, I had 3 children in 4 years, and between myself and many in my network, I know how real this problem is and how pervasive the underdiagnosis is. I'm a firm believer that we weren't meant to parent alone, and to navigate these journeys in these isolated, little bubbles. And so talk to me more about, are you guys going direct to consumer? Are you going also enterprise? Like, just what's the basics of the business model? And then I have more questions from there.
Veronica?
Okay. So let's say our vision is to build a digital therapeutic solution as a B2B model for the healthcare system. But in this way, we think that we can also put in place other business models and be, let's say, useful. Yeah. The first part is we consider, because we are an impact business model and an impact business project, and we consider that we have to keep some part of the content and the functionalities for free, so that for every woman is available. Yeah, that part, and it can be helpful. Then we are also putting in place a strategy as a freemium model, because we consider that for added value services, yeah, we can have this, let's say, way to monetize. And with this premium solution, we think that we can also leverage on other partnerships like health insurance companies or employers, that can be also a distribution channel and offer this as a perk or benefit, yeah, to patients or clients. And at least in parallel, we can build then the end solution, because what we have, let's say, confirmed, yeah, with the hospitals is that there is no tool so far that can monitor patients in all this journey. Yeah, and they are really highly interested in implementing a solution like that. Then it's a kind of hybrid model, yeah, a hybrid business model. So yeah, with 3 lines. Mm-hmm.
That's great. No, super exciting. Are you how do you build trust with your users in this kind of B2B2C model, if you will, where they're going through such a vulnerable life change inflection point of personal vulnerability with, shifting hormones, different mental health states? How do you envision the kind of that trust wedge, if you will, in shaping your Dana to be such a strong player in the market?
Mm-hmm. Sven, yeah, please.
Within the B2B2C, the idea is to work through the healthcare professionals, midwives, gynecologists, pediatricians. They all see when a woman suffers, but they don't know what to do. So the preventive solution is ideal for them. They can recommend something. And if there is a mood disorder or mental health pathology detected, then the psychologist or psychiatrist can use it as a medical device, as a monitoring tool during the treatment. So the person of reference is extremely important, and that's why we started from the beginning to talk with all the professionals and see how can a tool like this be useful to you, because we know that when you have a struggling a woman, having somebody that recommends you something is extremely important.
And if I may add something, I mean, we already have validated, for example, part of our psychoeducational programs directly with the target, because one thing is that if you are providing a tool, yeah, to someone who is suffering or needing some support, and you can really give them a tool, yeah, and they will feel better. Let's say this is enough, let's say, as a first step, yeah, to demonstrate that the tool is useful. Yeah, then our 30 psycho-educational programs that we tested with users have a 70% efficacy. Yeah, the users told us, okay, I have improved my well-being in using your app. But the second part is that we will build, and we are working now with the hospitals in the designing of the clinical studies, because we will, for sure, validate clinically that we are useful in two ways. One is improving the well-being of women transitioning into motherhood, and two, as an early detection tool, yeah, for the healthcare system in order to early detect, yeah, some kind of food disorders, yeah, and this will be validated with clinical studies, which is also a reference. Mm-hmm.
Great. One last question before I let Sophie take over. This is really exciting in a lot of ways, and I could imagine that community building as a part of the offering could be very powerful here, right? Other women being able to say, yeah, me too, and hang in there, and it gets better, and here's what worked for me. Are you picturing building community building? Where in the milestone inflection points do you want to tackle that?
So that goes back to what we did before, because was responsible for communities across Europe, and the sense of community is extremely important. It's not in our MVP2 right now, it will be in the next iteration. And the sense of community is not only about talking to someone, but also meeting someone, exchanging, knowing what feeling they had, at what time, etc. And we are embedding into some exercises the fact that you are expanding your relationship with somebody else and improving your communication. So the community is not only exchanging, it goes for what we call social health. And this is where we have a lot of information and tools to improve social health during this different period of time.
Super helpful. And I know I'll just ask one. Do I have time, Bharat? I don't know. Bharat's over there trying to cut me off. No, but thank you so much, Sven and Veronica. I personally think that, Bayer is also a women's health company, and we just know how important it is to be in women's health and to provide health and care for half of the world's population. But unfortunately, we also know that there are not enough data points even for women and in healthcare. And so kudos to you for going into this space, because also mental health is a huge thing to tackle. But I don't know if this is more of a suggestion, but recently the White House made an announcement, because you were telling me about sort of your plan from going from Spain, Germany, UK, US, and I kind of understand why, because I assume you're going to apply for the DIGA, which I think is a great pathway to take. However, just to keep in mind that there's about $3 billion that's just about to be introduced into the US market, specifically that targets maternal morbidities and maternal mortality. And so something to keep in mind, this market is very much open in the US. So I would also suggest you guys, really kind of take a look at that. And based on kind of your competitor information that I just kind of saw before, you guys have a very good chance of tackling a lot of kind of not only social determinants of health issues that are very much US focused, but something you should keep in mind. It's a suggestion, but that's all I have to say.
Thank you, Sophie. Thank you for this. Actually, that building this type of project is also building an ecosystem of people that are aligned with the purpose and will work together, to achieve results. And the reason why we started in Spain and then we plan to go to Europe is because, other countries in Europe is because Sven and me are both in Barcelona. But anyway, we started, to connect with the experts in the US and also in other parts of the world, because our solution should be global. Then once we have more, let's say, a little bit more metrics, and we have validated some things, we will also explore where is the better market access. Yeah, and we are for this talking to a lot of people in different parts of the world. But thank you, Sophie. Thank you very much for the tip.
Maybe we have time for one last question, Sophie or Christy.
Go ahead, Christy.
I get really excited about this topic just because it's so resonant with me and a lot of folks in my network. But one angle some folks are taking is kind of this influencer ability, right? There are celebrities, there are very visible players on social media that have amazing following by moms, prospective moms, and other parents as well. And do you have plans at all for kind of leveraging the existing channels that they have of people who are navigating some of these challenges and issues to go through those channels?
So maybe as a partnership, it's interesting, but we still see a difference between the toy and the tool. So the well-being app, which is a toy, can go with influencers. Usually they have their own idea, but 2 or 3 years after, when the kids have grown, they're also evolving with the solution. So you have to go back again. But really to have the healthcare system prescribing something, it's not through an influencer. It's through clinical studies and the layers of data that we will build since the beginning. And as you said, Sophie, there is no data from these 3 to 4 years. Nobody did it. So the idea is to create a set of data that within Europe will help us also to understand what is happening in this incredible moment.
Pave the way, you guys. Pave the way. They're really, they're really, it's really unfortunate and it's quite shocking, to be honest, that there are no women's healthcare data. It's incredibly shocking. So, good luck to you guys. Really appreciated this.
Thank you.
Thank you, Sven. Thank you, Veronica. Now let's move on to the next startup. Maybe right before we move on to them, just want to remind everyone in the audience out there, please add in your comments or questions for Dana or for the Lingos or for any of the upcoming startups. We'll address those right after the pitches as a reminder. Okay, next, I want to invite Yupnos to the stage.
Hello, can you hear me?
Arshia.
Hi. Are
Hi,
you able to see my slides?
Yes, you can. You have 3 minutes to pitch.
Wonderful, thank you. Hi, everybody. My name's Arshia. Greetings from the UK. I want to talk to you about something that's all pervasive. It's a disease that's not going away. And if anything, it's only becoming worse. It's respiratory diseases. And while it's a huge catch-all phrase, I want to focus very much on chronic obstructive diseases like COPD, which is emphysema, and bronchitis, bronchosemia, and also chronic asthma. The number here on the slide is pretty shocking because it's only talking about, while it's only talking about people who are diagnosed, that's 800 million globally, you've got billions who are yet to be diagnosed. And it is a gender problem, as you can see very, very clearly from the percentages here, but I'm going to leave that for another day. Don't want to get on my soapbox for that discussion. Now, the reason why, even though respiratory diseases are all pervasive, there are drugs to be able to treat them, it's still a massive issue. It's simply because these diseases are heterogeneous, meaning that the symptoms and presentations that each of us have are very, very different, which is why there is no established diagnostic pathway as yet. And what you'll hear when you go to see your doctor is to keep track of your symptoms and keep coming back until you have an exacerbation, and then you're put into secondary care, and then you go through the entire hospital pathway after that. And the costs just escalate and escalate. And even with treatments, it's all just trial and error to see what sticks and what doesn't stick. I've used the US prices here just to put a little bit of context here, even though we live in the UK. So what we've done to be able to address this problem is to really see how we could take the ability to create your own personal benchmarks. So imagine a moving mean. Your disease is heterogeneous. It's going to affect each person differently. But how do we know what is specific and what is a sentinel event for you? What is your biomarker? And that's really the problem that we're trying to solve. That's the unmet need. We are scaling the technology to be able to do that by using something that people already own, and that's the smartphone. There are 6.4 billion devices on this planet today, and that number is only increasing. These are supercomputers in your pocket. we have created a smartphone platform that converts the phone into a pocket laboratory. So we're using the inbuilt sensors like the microphone, the camera, the accelerometer to be able to provide objective lung function measurements, which are derivative of spirometry, which is the established pathway. We are using chatbots and questionnaires, which are again clinically established pathways to ask people for symptomatic data. And also, we have this fantastic feedback loop that we're providing through artificial intelligence and an adaptive interface to get people to measure themselves in the best possible way and to get the data. And the information is aggregated and then stratified, and people are then given their risk score based on a simple RAG interface. And the same information, the sentinel events, are then fit into a clinical dashboard. So what's special about us? What is our USP? As you can see right now, there are a whole plethora of hardware devices in the market today. We are basically condensing all those devices into a single app on a smartphone, and that translates into zero waste, no hardware, and also real world, longitudinal data, because these are not frequent one-off measurements when you go in to see a doctor. These are measurements you can do at home frequently. And also now we're seeing this whole notion of clinical remote monitoring and telemedicine becoming more and more of a reality. And suddenly you can do things like inhaler therapy, inhaler assessment, inspiratory flow measuring, and so on in the home using just your smartphone. It completely transforms outcomes and value-based care. In terms of how we go to market, we are using channel partners. We're a B2B company. We don't have a B2C play as yet. I'm talking to the American market here. So we're looking at the payers, providers, and pharma Venn diagram where we sit right in the middle. We've identified some remote monitoring codes, some CMS codes within which we fall very nicely from a provider perspective. And from a payer perspective, what we provide is real world evidence for claims data to see whether somebody is or not improving their outcomes in terms of the treatment they're receiving. Now, because this is such a massive market, what we've done is really narrowed down on where the low-hanging fruit is for us right now. And that's really in the distributed clinical trials area. Because if we look at emerging drug classes like biologics, there is still no data, A, on impact and efficacy on vein populations, on women, and also on multiple comorbidities and so on. So when you have a smartphone, suddenly the real-world evidence gathering potential is massive. So that's what we're looking at first. And then once we are able to provide that, insert ourselves into that side of the fence, then we can mass out into remote monitoring from a telemedicine perspective. There are some very successful companies that have already done this, so we know that it works. In terms of our current proof of concepts and traction, we won a proof of concept with the Ministry of Health and Occupational Services in Singapore. And also the maritime industries. And right now we're discussing a contract with the City of Helsinki and the Institute for Asthma and Allergies, and that's yet to be signed. I have a team of superstars. I'm really, really lucky. We are a technology company, which means we have a huge focus on our engineering credentials first, because if we're looking at transforming every single brand and every single model of smartphone into a diagnostic device, then we really need to standardize the performance on these devices. And also, if we're looking at digital biomarkers, we have to identify how we can make the AI make those correlations. So we're very focused on engineering. And the clinical rigor comes in from our team of advisors. Each one here is a key opinion leader. Each one brings with them medical expertise, industry expertise, and domain expertise in pulmonary health. In terms of investment, we're very much at the start of this journey. We're raising 750,000 seed, which brings us to our first milestone, which is a FDA 510(k) or CE Class 1 certification, which will then help us scale into clinical trials. And once we have traction and cash flow, then we go into our multi-site trials that gets us to CE Class 2. And with that, I come to the end of my presentation. Thank you.
Thank you, Arshia. That's all right. Yeah. Now let's turn to our jury members for any questions or feedback.
Great. Arshia is so excited about what you're building, and you're right, you have assembled a team of superstars, so congrats on that. It was actually interesting and resonant for me seeing in your deck a slide of the Bay Bridge covered in smoke. And what's so fascinating is what we're facing globally with climate change and increased wildfires and pollution. I think the timing is right for something like this. So very excited. Talk to me a little bit more about where you're starting. I saw the milestone slide briefly, because you have both the diagnostic kind of element that's very hardware and device driven, but then there's also this big software play involved in the go to market. How do you view kind of clinching those milestones as you go, and kind of shifting towards that revenue driving activity?
Absolutely. So what we found after speaking to a lot of industry is for us to get into the distributed clinical trials industry or vertical. We can do that with the CE Class 1 mark device or the FDA 510K mark device. So our objective is to first achieve that, because it's a lot simpler in terms of evidence gathering. And after we do that, and once we have our foot in the door, then we scale to Class 2, because by that point in time, we'll also be able to raise more funding on the back of the evidence that we're generating. Because right now, that's the barrier we're constantly hitting when we're asked for evidence, and it's a chicken and egg situation story.
Absolutely. This is really, really exciting. Are you bumping up against the big players in the device space, and how do you view kind of getting your elbows out there, if you will?
Sure. So the big players for us are very much the companies like Nuvo Air and Mir and the rest of them. And I think the biggest advantage we have is that we're not dependent on hardware, not in the slightest bit. So each of these devices, the Nuvo Air as an example, retails at about $600, and that's not counting for the cost of consumables. And the same one for the Mir, because at least in America, they're reimbursed on the number of data points they're able to provide. So if you look at the all singing, all dancing device, that's how much they cost. And we're very big on zero waste as well. So each of those tubes, I mean, heck, it's paper or it's plastic. So it really adds up. And we're not adding consultation time as well, because reading a spirometry report is not easy. And also, it's a very, very effort-driven maneuver. So what we're doing is that we're taking away all of that. Instead of having a child, I mean, children can't do spirometry for a start. So instead of doing the, what we've done is transferred the way of measuring vital capacity by just holding your device up and going. So it's really, I would say that's why I always, it's a derivative of spirometry. So we're completely moving the needle when it comes to all of these various measurements. And by taking away hardware, you're suddenly democratizing access to everybody, including Medicare, Medicaid, veterans, and so on and so forth.
Very exciting. I can see if you're successful, we're also uncovering a massive market, to your earlier point, that is just latent and is just sitting there. So it'll be very interesting to see how that TAM goes up, if you will, because we're starting to see just more increased access to even diagnosable patients.
And I think there's just one more point which I should have stressed a little bit more on. So if you look at traditional diagnostic pathways, you go to see a healthcare provider, they triage you, and they ask you a lot of questions. They don't just make you blow into a machine. So what we've done is that we're looking at multiple symptoms, and just by virtue of it being a smartphone and next to you at all times, nocturnal symptom monitoring like cough, frequency of cough, disordered breathing, sputum assessment using the smartphone camera. I mean, we come from mobile, so this is normal for us, sensor fusion and multimodality. So we're looking at condensing or aggregating multiple data points, which then arrives at an individual biomarker. And it's a moving mean throughout the disease progression. And that's how we differentiate vis-a-vis the hardware big guys in the market.
Great, thank you.
I do have a follow-up question. It's a little bit what Christy was touching on earlier, and also you mentioned, I assume you guys are currently in trials. Am I correct on that?
Yeah, we're in the process.
Okay.
We've done some very small scale trials, because we're subsisting on prize money from here and there and everywhere, scratching the surface, seeing what you can find literally. And because, like I was saying, we always get pushback about evidence, which is why we're writing a lot of grants, and we hope that once we win some grants, then we can go out there. But to date, thanks to the Singapore win that we have, we've managed to do about 250 people in all.
That's great.
But it's not. But these aren't diagnosed conditions. These are people who work in shipyards, and we're finding Yeah, we're finding obstruction. That's why we're trying to raise funds to be able to do those hospital equivalence trials with quality assured devices and so on.
Yeah, because then maybe this is more of an existential question, but when you're going up against some of these, these big device companies that are already in hospitals, all the doctors use them. It's just that's just what they know, right? And this is also a similar question I asked a company that we saw that was measuring NO because it's such an invasive process. And the question really is, if you completely take away the device, I'm a firm believer on digital biomarkers, right? For me, what do you imagine that sensitivity and specificity will be for your algorithm when you just blow on a phone, right?
Mm-hmm.
Like, what do you imagine it to be? Because I know that you're still going through, the collection of evidence, but I'm
Yeah.
really curious where you think you'll fit in within that threshold.
So interestingly, I'm so glad you brought that up because interestingly, with lung disease, because again, it's so variable between people. It's really the trend that matters and not the absolute. So
Interesting.
so that's the reason why when you're able to do that on a continuous basis, because when you go into hospital, at least in the UK, it's once in 3 months, and in America, they want because it's expensive every time you have that interaction with your healthcare provider, it just doesn't happen often enough. So when you have the device at home, and a lot of it is actually passive, and it's listening to you during your sleep and so on, and it only notifies you when there is a change. So there are triggers. So it learns from you if you're not moving too much, Sophie, and you've already been diagnosed with, say, asthma. It'll ping you and say, "Hey, Sophie, what's up? Do a test today." So it's really adapting to what you are doing, and hence the moving mean. So that's the reason why. And also things like adherence. If you look at devices that plug onto things like inhalers, that's all very well. But one of the things that we do is correct inspiratory flow. So when you match inspiratory flow and how often you go to get your prescription filled, you don't need an inhaler, anything. It's temporal. So I think we're kind of really reinventing the way these pathways are actually being defined right now. And I think that's really exciting for us.
I was just about to say, yeah, you're really redefining how some of these diseases are actually diagnosed, which is, kudos to you. Very cool stuff.
I don't know whether
I'm
it's
just
stupid or optimistic.
No, don't say that. I'm just looking at Bharat because he's also looking at me. He's like, you guys gotta go.
Great. Thank you so much, Ashia, and thanks, jury members. We'll move on to our fourth startup here, Health Flows. I'd like to introduce Matea from Health Flows.
Hello,
Hey,
everybody.
Matea.
Hope you still have some energies. I'm excited to tell you how we are collecting stories from patients to inform the healthcare system. Let me start from this amazing team. So we're putting together business, medical, and tech expertise. I am the business guy. I've been working as a strategy consultant before, especially in the healthcare and with pharma companies. Jonas is a medical doctor, and Adriatic is a computer scientist who has been spending the last 6 years developing the technology that today we're bringing into the healthcare world. Well, let me start from this. The problem. There are 300 million Facebook groups related to health condition. It's a huge resource for all the chronic patients out there. However, the wisdom of the crowd that they would like to find in those groups is not captured. Think of this. In a Facebook group, information gets lost. You post something, the next day it's over. You get misleading peer advice, people telling you what to do. But even more important, you don't get the emotion that you would need. You are feeling pain, you want to talk to someone. You only get posts and like. What's our solution then? We're building a tool for those communities. Think of this, you as a patient join the community, and by joining, you detail your journey step by step. Based on the journey that you share, we group people with a very similar condition, feeling the similar journey, and let them meet, talk to each other in our virtual events. And then we feed, with all the data we collect, with all the journeys, we feed a dashboard that allows each single user to see how others are dealing with it. And I want to pause for a second, because think of it. You as a patient will be able for the first time to see how others worldwide feeling the same pain are dealing and handling their lives. I also want to share a little bit of our technology behind it. Think that only by capturing the stories, so 500 stories, we managed to create this long COVID, which is our first kind of pilot project. Here you can see on the right the patient journey of people with long COVID. Before you've seen the journey of COPD on a slide, right? Imagine having this as a patient journey, like seeing how people exactly move into the healthcare system. And now you can see here people with long COVID waiting for the vaccine and queuing up in December 2020 because they're waiting for the first vaccine to be released. This is a real-time way of looking at the patient journey, just by starting from patient stories. Of course, who can be interested from such a level of understanding? Our partner are pharma companies, hospitals, and health insurance, because what they all have in common is that they need to have a better understanding to what happens in patients' lives so that they can better serve them. And think that our business model is, it's a platform, therefore it's very easy in this sense. So on the one hand, we are building something great for people. They can learn from each other, they can talk, they can get emotional support, but not going through them directly, but through patient groups, because this is a big resource that we have in our world, and we need to give them the technology that they need. On the other hand, our platform, our knowledge that we generate will be helpful for pharma, hospital, and health insurers to map and understand more the patient journey. Today, the patient journey already gets mapped from healthcare players. We are offering just a cheaper, evidence-based alternative to that, which is much better. Why is it better? Because today, the journey gets mapped top-down by interviewing and doing workshops. What we do is mining bottom-up from stories of people and get it to a much higher quality journey. We do it in real time, not a project base. We look at the end-to-end journey because each patient knows the full story from early symptoms to current states. And we also get their feelings and their unmet needs that from the medical institution and hospitals you may miss. We put the patient in the center, therefore, and at a much lower price for the healthcare system. Thank you.
Thank you, Matteo, for the presentation. We also have Jonas from Health Flows who will be joining for the Q&A session.
Yeah, we'll be amazing.
Great. Over to you, Jonas.
Thanks so much, you guys. My initial question, I'd love to understand where in that commercialization journey you guys are currently in. So are you guys currently data mining? Are you sort of pilot testing? Like, where are you guys right now?
Yeah, so we started with long COVID as the first chronic condition we're targeting, and we already collected more than 500 users that are currently on board in our platform. They are talking to each other, they are sharing their stories, and therefore we started mining the data. And we also generate insights that are not available. We know that cognitive impairment in long COVID is much higher for hospitalized people. We know that the recovery time is 25% lower for people who got vaccine. Those kind of information, unless you have a full journey of someone, no clinical research available today will be able to provide. So we are at that stage. Now we're looking for some partner to bring this to other chronic conditions, the same technology, or kind of to build much more on the long COVID case.
What other sort of indications or disease areas do you guys want to go into? And I don't know if this is more partner dependent or if you guys, because it seems like you already did it for long COVID. So I'm just assuming you can also do this for example, like diabetes or, PCOS.
Exactly. So there are a number of other diseases that come in question regarding this. We think especially about chronic conditions where people have a very individual patient journey and where they have questions about their journey that are very dependent on their own experience. So many different combinations of ways, pathways through this journey. So a couple of other diseases to mention is, for example, endometriosis, chronic bowel disease. And at the moment, we are setting up, and that's the point you just brought up, a study on colon cancer regarding this. So this is where a partner, a university hospital, came up to us with the idea because they said that's a cool technology. Let's try to use it. We have a couple of colon cancer patients. So we consider ourselves as disease agnostic, but for sure, it's for certain chronic conditions even more eligible than for others.
Very cool. Very cool.
Thank you for building in this space, first of all. This is an area super relevant to everyone, and I love the energy around it. a question I have is really around what's the intersection of the clinician involvement with the patient-driven community, right? Because what's interesting, at least from my understanding with long COVID, for example, or chronic fatigue syndrome, myalgic encephalomyelitis, is that to the carpenter, everything is a nail, right? So if you have a pulmonologist looking at the problem, they're looking at it with one lens, an immunologist is looking at it another way, cardiology is looking at it from a vascular function and POTS perspective. How do you build in all of these carpenters, if you will, into the patient community in a way that builds trust, but also kind of keeps that true north within the purity of the patient voice?
So maybe, I can start. So in the overall model, it's not a big role that physicians play. So we really focus on patient communities. We go to patient communities. We want to hear the story of each single person to build the model and the condition. Of course, this can be helpful for them, right? Because if, probably for the first time, a physician can see, even across regions, so across healthcare system, how a specific case gets treated on average or going deep down into the specific thing. But the model, the way we're setting it up, doesn't involve physicians playing an active role in the data collection and in the data mining. The data collection will be on us and on patient communities. We do the mining with our unique technology, and what we offer is an access to the model. So just access on an annual subscription program basis, as we are formulating it, for healthcare players who want to understand what happens for that specific chronic condition across the patient population.
So in essence, is it fair to say that you're actually removing that initial lens that in so many journeys is placed over the specialist lens, if you will, by going back to the pure patient voice?
That's exactly it, yeah. So we understand when they go through the doctor, but not from doctor's voice, but from their voice.
Yeah, fascinating. How are you envisioning, or have you done any A/B testing around stickiness with the patient community? How often are they coming back? I can imagine some of it's disease specific or inflection, specific when there's exacerbations of a condition. But are you getting any initial data around that stickiness and that engagement?
Maybe to clarify on there a bit, so we ask the patients to tell us their story at first, right? So it's not a boring questionnaire where traction is very low. Patients are really bored by questionnaires where they have to fill in everything that's needed. They can just tell us their story with free text. And we say we take the burden of analyzing the text, and the feedback is quite amazing. So on average, they spend 23 minutes to share their story. And just with the tool they found on the internet, right? And this is really amazing what they write to us. Yeah, some whole paragraphs with information other questionnaires wouldn't get. And the feedback is, this is the best tool I've ever used because I can finally freely express myself. I can write everything like socioeconomic, I lost my job because of this. This is again making me depressed and so on. Like all these nuances we can get. So this is kind of the basic the basic idea that we collect really stories.
Mm-hmm. Probably, yeah. To add on this, I think we are also organizing weekly events for people to come and talk to each other. Right? We a little bit are kind of surfing on the engagement of the community. So again, we don't take community people alone, right? We go on a community. So already people come back in the community even without us. So if we manage to position us as on top of the community, engagement comes, by definition from the community itself, from Facebook groups, basically. But on top of this, we organize those weekly events. So people keep coming back because they want to talk to each other. Maybe the journey evolves, right? Because they had a surgery from last time. So now they get matched to people with surgery so they can talk about the post surgery. And I think we have, very good feedback from people that join the event and, they're coming back on a weekly basis.
Okay, and just one thing I forgot to mention, like your actual question. So we collect them at the moment retrospectively. So people tell us their story, what happened. However, we start collecting data prospectively, where whenever something changed and they feel like they want to communicate this, they can communicate this to us via the app. And we think that we will have a much better traction regarding this because we put really the patient at the center. So we provide value back for them, and we don't try to just get information for our study or our stuff. And the value we provide to them is these two sides, Matthias said, right? Data-based, how are others like them performing? How are the journeys of others like them? And conversation-based, where we cluster them by similarity and let them talk to each other whenever they want.
Do you envision
Also,
a future?
to add
Hello.
something. Hi, I'm CDO Adriatic. So you cannot, patient cannot query, like say, less symptoms. In order for them to understand, to learn from the others, is just to share the story up to date. So if there was an event in their life, they can say, okay, I had this event, and automatically they will get matched with people which recently had that event. So this also makes it's in their interest to update the story. Sorry
I love
for
that.
the
No, it's great. Do you? One last question before Bharat gives me the nasty gram. Do you envision a future where you're capturing data that pharma is really interested in from a real world evidence perspective in terms of capturing the patient's journey? And is that a space you would envision going into? And then how do you maintain patient trust by not becoming, an optical pawn of the pharma industry?
Yeah. I really love this question because it has two answers. So on the one hand, I would really try to demystify the thing of patients. Patient needs support. Patient needs to be helped, and in long COVID especially, they feel that nobody is understanding them, right? So if someone, call it pharma company, can use this information to improve their life, they're all in for that, right? And this is it's a very important thing. But the second thing is that we're never gonna hand over data to any pharma company. We do want to position ourselves as a tool for RWE, and we generate real world data, right? It's right there. The thing is that we allow them access to the journey model. So it's aggregated data, it's completely anonymized, and it's completely, it's already kind of mined. We have the technology that maybe not even the pharma has. So if we share our database, they would not be able to kind of understand the journeys from that. What we offer them is a dashboard, anonymized, aggregated, where they can play and see, okay, show me the diabetes type 1, 30 to 40 people who are feeling this. What's the medication people are prescribing in that country?
Yeah, that's super interesting. And just before we go, just one suggestion is I think Christy asked all the right questions. How do you become like a trustworthy source for patients? Because, at some point, they're giving you all this data. So you don't want to, lose sight of that. But in terms of longitudinal data collection, I think you guys are in a really interesting position and you should look into this, right? Understanding the public health side of it, so health economics, but also looking at, I know you're collecting currently like retrospectively, but also you mentioned that you are collecting prospectively as well. But to look at, what's that longest set of data you may have, right? This could be a massive database ultimately at the end of, at the end of your big startup journey, being a unicorn. You never know. But that's just a suggestion because I think you guys are going in the right direction for something like this. And this is aside from just pharma companies. I mean, government would be willing to also look into this data as well, right? A lot of public health institutions and also a lot of, public clinics and things like that. So something to think about.
Thanks a lot, Sophie, for this. And I really, it really triggers me our bigger vision. So now we pitch our product today, but the bigger vision is by collecting the journey, we are setting up a framework for people to add on that much, much more of the data they will own. And one day, our big vision is to build the largest longitudinal healthcare data knowledge, because we are not going to do it integrating IT hospital systems. We're going to do that asking to patients.
Cool. Very cool.
Great. Thank you so much, Matteo and Jonas from Health Flows. Ambitious indeed. We are making great time, no worries. We being a German company, we're sticking to our punctuality. But yeah, next I will like to invite our last final startup, last but not least, Isla Care. Hey, Peter.
Thanks, Bart. That's great. Thanks for the introduction. I'm pleased to hear we're slightly ahead of time. Very good. So yes, we started Isla fundamentally because we see health systems all around the world creaking at the seams in terms of capacity. And so I guess the way we approached this problem was to really sort of reverse engineer right back to the fundamentals of what it means to deliver care. And so we've broken that down into, I guess, a fairly recognizable process of observation, to collect information about a patient, their condition, their desired health outcomes, their health history, and then an analysis step where we start to interrogate that data, use clinical experience to assess what a likely decision should be about treatment. We then make that decision and we move into treatment. And in an ideal world, we go back around this cycle where we start to observe the impact of the treatment and assess whether that's the right thing to do. And so at Isla, this process kind of currently takes many, many months to get around the cycle once in a typical hospital setting. And so we're trying to essentially automate the first 3 steps of this so that we can move around this cycle in real time and at a much faster cadence than we ever have done before. And so to put some kind of meat on the bones, we've built Isla, which we think is the most powerful remote monitoring platform available in health today. We can monitor across a very vast range of health conditions using a combination of images, videos, and structured assessment forms, either ones which clinicians have defined and we've built for them, or often NICE approved clinical observation questionnaires. For the patient, we built this to be super seamless. So they will receive a link, normally through email or SMS, which is kind of the most ubiquitous technology for getting communication out to patients. And they can securely then submit information into their clinicians in the hospital setting. Step 2 then is as we start to collect and aggregate that data, that we want to kind of automate the layer of intelligence which currently lives in clinicians' heads and which actually is broadly based on pattern recognition. So we can start to use tools like computer vision and AI to detect observations from images in particular, and also to use fairly simple algorithms to sort of pre-score and risk assess patients based on clinical assessment questionnaires which they're sending in. Once we get through that step, then we need to move into the decision point. And here we're essentially building an interface to allow clinicians to at a very granular level dictate the parameters that they want to set to be notified when a patient kind of moves out of tolerance based on the monitoring data which patients are constantly submitting. And we believe that if we can define that at a granular enough and powerful enough level, then clinicians will essentially kind of crowdsource towards the right solution in terms of when they should be notified and when that means they should bring a patient immediately back in for an assessment. And so we're based in London. We've launched over the last 18 months and we're scaling very quickly across the NHS. So we're now working with 16 of the leading UK health trusts. Our week-on-week growth is 8% over the last quarter, and the platform usage has grown by 1,200% in the last year. As I mentioned, we're kind of building to be valuable across as many services as possible. So we're now supporting over 30 different clinical specialties, all the way from breast cancer through to ophthalmology, through into community services with physiotherapy and district nursing and tissue viability, et cetera, et cetera. In terms of our technology and partnerships, so we've taken a very kind of partnership-driven approach from day one. We've integrated with some of the leading clinical EPRs already, and we've just recently signed a partnership to help develop some more of the computer vision and AI pieces, particularly in the image setting. We've had a big year in terms of team growth. So we've grown from 3 to 19 people over the course of 2021, and some really key hires into engineering, head of delivery, our computer vision lead is now in place, and our financial controller. Across 2022, we're expecting to grow to 70 to 80 people in the UK. In terms of the market size, I think we probably all recognise that there's a huge interest and investment from governments and health systems into digital health. And so the market, as various people have alluded to, is absolutely exploding. Within the UK, we think the market is, for our existing products, worth 40 million. And then you can see in the table that scales with different health systems. Our current revenue, we raised £250,000 to start the business nearly 2 years ago. We've now just exceeded £1 million in ARR, and we're expecting to get to 1.5 million in Q2 of next year. Thank you. That's it.
Thank you, Pete. Now I'll hand it over to Christy and Sophie. The floor is yours.
I definitely have a question that I ask all AI companies in dermatology. So, you're serving a population that's very diverse, right? Especially, even in the UK, even in Europe. initial question would be, how do you guys overcome AI bias, right? So with a lot of people of color, a lot of dermatology companies that I've seen, train the AIs on currently available data, which is totally fine. That's how you start. But unfortunately, that currently available data, at least 90% of that data are from white skin color. And so my question to you is, do you guys have plans? Have you already thought of something like that? What are some of those steps that you guys as a company are taking to overcome that barrier?
Yeah, that's a great question, Sophie. So I think there's probably two parts to the answer. First is that we're probably, unlike some of the companies who are trying to diagnose skin cancer for example, with AI, in that we're trying to break that down to a more granular set of observations below that. So we're not trying to detect skin cancer and present that back to a dermatologist. We're instead trying to let a dermatologist or any other clinician define a set of things they might want to have flagged to them. So it might be that they want to see exudate from a wound, or it might be they want to see localized redness around a particular condition, rather than trying to define the actual condition that we're observing. So that's one part to it. But that certainly doesn't take away from your point, because there is a huge bias in terms of the existing data, as you say, weighted towards people of white skin tones. So we're very proactively addressing that, in that our very first collaboration project with the NHS is specifically designed to look at signs of surgical site infection, with a specific focus on people with non-white skin tones, essentially to try and patch that gap. And the way that we'll do that is by using the data that we're capturing predominantly, rather than historical data sets, which is much more representative of the diversity of the UK than historical data.
Great, thank you.
Peter, this is a really exciting model. I know that it's also more intensive on the cost side in terms of the upfront costs for developing the algorithms, for training them, for maintaining them, et cetera. How do you view that impacting the cost of your team and the cost of the resource outlays as you grow? And talk to me a little bit more about that commercialization mindset for where you want to start, and how you're planning to offset that if you want to be just fundraising a lot more cash up front, or if you have specific milestones in mind to navigate that.
Yeah. So we are going to go into a fundraise in 2022, mainly because we think there's a certain rate of growth that we can achieve on revenue, but there's just this huge opportunity in digital health at the moment, kind of in all markets of the world. So we really have to seize the moment. So yeah, we will accelerate our fundraising in order to keep pace with demand. I think I always I think there's so much kind of excitement about AI and computer vision. People always focus on that. The thing that drives revenue for us at the moment is solving actually a very simple operational problem. It's that the vast majority of health information that's been generated and will be generated over the next decade will come from patients. That's a given. It will also come from, as we've already heard, devices, particularly smartphones. And so really what we're solving now is we've built the most seamless way for a hospital to get vast amounts of that data in real time from patients. And those patients could be anything from pediatric services where mums are taking photos, mums and dads, right through to much, much older people who are rapidly becoming very sort of familiar with using smartphones as part of health.
Really exciting. So a question on the actual technology side, and it goes a little bit back to Sophie's questions in terms of diversity in data sets. What dependencies do you have on the hardware and the quality of the cameras on the phones that you're using? So for example, the West African side of my family, in the early days of the iPhone, the photos were terrible and the rendering of the images was terrible. And that was a constraint and a dependency on the hardware. So you're then waiting for the hardware devices, or the hardware manufacturers, if you will, the phone manufacturers, to innovate there. How are you navigating that, and how do you overcome that? Not every patient with a diverse skin tone, for example, is going to have access to the $1,200 smartphone with the sophisticated, high megapixel camera.
Yeah, that's a very astute point. We are very tightly linked to that development of hardware on phones. Luckily, it's not a bad thing to be linked to. So over the last 5 years, we've moved image quality forwards in terms of sort of your average smartphone by about 50 times, and that rate of increase is sort of there's a second differential there. It's increasing faster than that going forward, and so I don't think it's going to cause a significant problem. We're not reliant in terms of most of the value that we add on very high resolution images. So, for example, we've specifically steered away from the latest iPhones where it is super exciting technology. You can do a lot with 3 cameras and triangulated images in terms of depth perception and various other things. But we've very specifically steered away from that in order to solve the problem kind of at as wide a scale as possible. So you're quite right that this won't apply in every health setting yet. But I think over the next year or two, we'll see a much faster penetration of kind of at least mid-range smartphone technologies into developing countries.
Sophie, if I may have one more question before I'm really excited about this topic in this business. How I can imagine as you build out your sales team, depending on the market you're selling into, you may have many stakeholders at the table, and so the cost of a really talented sales team, or in the earlier stages, like right now, it's more difficult because you have such a robust digital health market. Talented sales folks can go to a company that's mature and has line of sight on an exit in 12, 24 months. How do you view that, really, I guess, building out the right talent or focusing in the commercial arm of the business as you navigate the markets?
Yeah, another very good question. Do you want to be an advisor for us? It might be helpful. So yeah, the commercial side obviously varies very much, I think, from country to country. And so as we start to scale outside of the UK, which is where we've been based so far, we will set up local offices in order to kind of have that footprint and that voice at the table and the kind of presence at, all of the things that make healthcare actually move day to day. So the events and the conferences and speaking events. So we will have to kind of localize sales teams into each environment, I think. In order to slightly mitigate against that, we've taken a very collaborative approach with partners already. So some of our key partners, Cerner and Allscripts PAS and various others, have a very good penetration already across various different health systems. And so through building those interfaces, we're able to essentially be kind of a layer that sits on top of those that's available to a range of markets already. So the commercial arm will both be active in every country that we launch into, but also we'll go through partnerships.
Yeah, I'm anticipating you'll hit this interesting inflection point where you build out support around you in all of, especially on the product and on the Eng side, to really weaponize your time to be that chief commercial until you hit this really steep inflection point, and then rapidly you're bringing on the strongest sales talent in each of those markets because of the sophistication of the sell and the different languages of the stakeholders involved, especially in the US market, for making that sale. Yeah.
Great. Thank you so much, Pete. We'd like to open up the floor now to the audience, to you guys out there behind these screens in your homes, in the offices, or traveling maybe, perhaps. If you have any questions for our startups that pitched today, as well as to our jury members who are experts within the digital industry, please feel free to add it in and we'll get to those. Great. I think we have our first question to health flows. So can we have, great. So the question is, are you looking at other chronic disease areas and the patient's journey? I have a question from LinkedIn.
Yeah, I think at least partially this question was already asked. Of course, it makes sense to have like one vertical in the beginning where we really prove our concept, because it's very new to use free text and just patient stories. But then we plan to transition to the next vertical, and we see ourselves as disease agnostic. We think it's especially strong because 25%, 27% of adults worldwide have at least 2 chronic conditions. So that's where, for example, there will be interesting interactions, and we already see this with our data where patients have different other diseases as well.
Yeah, I get a chance to maybe cover something else that we didn't have the chance to say, but we are partnering with the university hospital to launch a clinical trial on colon cancer. So we want to try the same technology, which on the one hand collects the journey so far, and on the other hand let them talk, so feel less alone, talk to others with a similar journey, share experiences, share support on a recovering basis, and try to demonstrate that with allowing patients for that will improve their quality of life, treatment adherence, and acceptance of the disease. Those are the three kind of endpoints we're measuring. And this clinical trial is starting in the coming weeks. So yeah, it's interesting to see how also we scale to the next chronic condition.
Great, thank you. We have another question from Lee. So are patients paying the annual subscription? If so, how do you convince them using your paid platform versus the free platforms where they share their story?
No, yeah, I want to be super clear on this. This is going to be completely free for patients. So I mean, we want to help them. We want to building the technology for them, starting from collecting their experiences and giving them back the experiences of others like them. This is a tool for patients, but also for the patient communities that today are left a little bit alone without technology. They have Facebook group is kind of the max they can get. With our technology, they can step up in the healthcare system because that's anecdotal, but one of the patient association admin said to us once, we are an open book, but nobody's reading us. Of course, they are an open book because it's a lot of people writing, but nobody can read them because they are not data, they are text. We're turning that text into data for them, so we kind of upgrading patient communities in this sense. They become more aware of the patient they are in, and they can even play a role in the healthcare system thanks to this technology. But all of these will stay free for that side of the platform. We're going to also offer our insights to the healthcare system, which is how we're going to sustain the whole platform.
Thank you. Do we have any more questions? This would be a chance to ask our startups the questions. If not, you could also reach out to them on LinkedIn. Sure, you can. I'm sure they'll be happy to answer your questions. Okay. Thank you so much for joining us today. I'd like to also thank everyone who has attended, as well as the startups who pitched. Great job. And I'd also like to thank our beloved jury members today for their questions and feedback and for listening in to the pitches. We will also announce the Pitch Club winners next week. And also stay tuned as we are opening our applications again in January for our Pitch Club Q1 2022. You can follow us on our website, on our social media channels. Here on the screen is also our common mailbox. You can reach out to us in case of any questions. But happy to have you here, and thank you, and have a great weekend. Oh, so sorry, we got another last question. Maybe we can take this and then end it. To Jonas from HealthFlow, how is that in relation to MDR?
Can you hear me? Yeah. So this is very interesting. The very interesting question. We've been looking at this carefully, and MDR is kind of the regulation for medical devices. We are not following into a medical device. We are not intended at all for prevention or for treatment of any condition. We just want to bring up the evidence, collecting it from people and giving it back to people. It's basically what a Facebook group tries to do, but they cannot because it's just text. We turn the text into data. We could self-declare a medical device if we wanted to. And it is also an interesting path we're looking at by doing this clinical trial. If we can manage to demonstrate that this tool will also improve the quality of life of people, we definitely can also investigate the path of becoming a medical device. And since we're based in Germany, in Berlin, even at DIGA, as we talked about that before. But this is not the scope for now. We're not intended for prescription treatment or diagnosis.
Thank you. Thank you for popping in once again. So yeah, if there's no more questions, we can then end. Thank you so much for joining, and have a great weekend.